Learn how to self-treat your rotated pelvis with focus on your fascial system. Have you ever been told you have a pelvic rotation? So in this video, I'm going to talk to you about how to self-treat a pelvic rotation if you know which direction it is. So let me just say first off, you don't want to do this without some help from a professional, okay? If someone's told you, great, but kind of totally troubleshooting this yourself isn't always recommended. I'm Dr. Cindy Hodgson. I'm a physical therapist, exercise physiologist, owner of Essential Therapies, and I have been teaching people how to fix their pelvis with rotation for about 25 plus years now. So I'm going to walk you through how to do this, and first of all, explain to you what's going on. So there are, first of all, many things that can happen to the pelvis in all different planes. So we're just going to talk real briefly about each thing and then really focus on the rotation because you don't have to know all the details, right? So first of all, what can happen is when we talk about rotation, we're talking about simply one side of the pelvis going forward or backward. But there are so many other things that can happen. You can have one side go up like this, we would call that an upslip, and then you might have it rotate this way. You might have it rotate backwards. It might go in this plane. So if you're standing here, like the whole pelvis could be more forward on the left side in a transverse plane. It could be more forward on the right. You could have all three of these things going on at once and then some, okay? So what you don't see here is the fascia. So as you know, we focus on the fascia here. And so what's pulling the bony structure into all these different directions is the soft tissue. Fascial restrictions, scar tissue, you name it, it is very strong. It pulls your structure off. When that happens, and you go to the doctor and you get x-ray, MRI, CT, they see the final thing, which is the bone position. What they're not seeing is the soft tissue component, okay? So what we're gonna work on and what you can work on at home on a regular basis to change this permanently is to work with the fascia. So most of the time, and here's an interesting tidbit, is that 90% of the time when people are rotated in the pelvis, it's the right side that's going forward. Or you could think of it as the left side is going backward, okay? So if you have a right anterior rotation, the right side is going forward, the back is going left, but you could also say left posterior rotation also creates a right anterior rotation. So let me show you on this smaller model. Here's the ilium on the right, the ilium on the left, and the sacrum in the back. Here's the tailbone. So you can see how this could cause all kinds of problems in the low back, in the sacrum, in the pelvis itself, in the hip joints, okay? So if this pelvis is rotated, then everything all the way down is off. It ends up resulting in one leg being longer, one leg being shorter, and then every day, all day long, you are pounding on an imbalanced pelvis. It creates little micro traumas all the way up the chain. It can affect everything from your big toe to the top of your head. No kidding. So it is really important. This is why we look at everybody in standing, in laying down. We look at all the positions to see if the pelvis needs balance. So if you have a chronic rotated pelvis, I'm going to walk you through both directions. Now, not to say there aren't lots of other things going on, but this can really help. And for years, I've given people this exercise to do on a consistent basis so that we can make progress, and it works. So Anne has a right anteriorly rotated pelvis. And in standing, I could see that by looking at her landmarks, but that's hard to see for yourself, right? So I'm going to give her a little bit of a cue of how to know if that's still going on. Now, I wouldn't have someone do this if they hadn't already been evaluated, of course, and we know that this is a tendency that continues to happen. But if she's working on it on her own and she's getting some improvement, we want to have a little bit of a trick to tell if it's working or not. So I'm going to have you do long sitting. So you're sitting with your legs out in front, and I'm going to give you a hand. And when you come up and sit up front, you don't want to move your pelvis around once you get there, okay? So go ahead and come up. And let's see if you can tell. Can you see your ankle bones right here? Mm-hmm. Can you tell that one's longer?
Yes.
Which one?
Right is longer.
The right is longer. So when the pelvis rotates forward on the right leg becomes longer. So this is how you know it's off. And so you can self-treat. So go ahead and lie back down. So just to review, if this is the pelvis, the right ilium is rotated this way toward me. So in comparison to this right side, the left side is going back, okay? So you could call this a left posterior, you could call it a right anterior. Some people name it based on which side there's pain, if there is pain. So Ann, do you have any discomfort?
Left SI is always painful.
So the left side is painful. So what I'm gonna do is just feel gently if there's restriction. And actually when I go to press on your left, can you feel that? It is.
I can feel it in the back too.
Yeah, and it's tighter when I do that little pressure. So technically she has a left posteriorly rotated pelvis, but it's the same thing as the right anterior rotated pelvis, right? So I just get used to saying it that way often. So if you think of it this way, this is going forward. The sit bone is technically closer to the floor then. So what I want to do is use the wedge, I'm just going to do this on top of you to make a point, to go underneath that sit bone. That's going to make it force towards a posterior rotation. On the other side then, you can help me by holding the pelvis. On the other side, the ilium is going backwards. So, whoops, this one's on an angle, by the way. You can see how it's kind of on an angle under the hip. I'm going to hold that right there. This one is going to go horizontal, straight under the ilium, like this. Okay, so we'll get a picture of this to see it straight down in a moment. But so you're going to have the right sit bone is going on an angle underneath, the left is going across this way. You can also go ahead and remove the wedges. You can also use these balls. So a lot of times people have these small balls around. We would put it underneath the sit bone and underneath the ilium here, okay? So that's another way to do it. But we're gonna use the wedges on Ann right now. So go ahead and bend this knee, and I'm gonna lift this up. Here's your sit bone. I'm gonna go on an angle, and there it goes. Because I feel like it's under your sit bone.
Mm-hmm.
And then on this side, I feel where that top of the pelvis is it's where we put our hands on our hip, even though it's not really our hip joint, our hip joint's down here. So on top of the pelvis right here, we want the wedge to go in horizontally directly under there. Okay, go ahead and lay down. So that's gonna rotate it more forward. So does that feels funny because you're kind of uneven?
I feel like this should be a little higher.
Feels like it should be higher.
I feel like it's in my butt bone or butt.
Well, you're little. So right there it is. I mean, I don't want it to go above the pelvis. Okay. So feel how your bone is right there and the wedge is right under it. Yeah.
That feels better though.
Actually, I'm glad it feels a little bit better.
Yeah.
So you don't want it in the small of your back. Okay, you actually want it on the bone of the pelvis. So Ann's gonna hang out here for hopefully 5 minutes, and she'll wait. It can be longer than that if it's not uncomfortable. But the whole purpose of this is to take up the slack of the tissue, the tight tissue that's creating that rotation. Okay, so if we wait and wait and wait, we're waiting for that taking up the slack, wait for the fascia to change, that collagen portion to actually make a shift. And so after we've been here for a while, and so if she was on my treatment table, I might do several other things and work on her while I'm letting this do its thing. But if you're just doing this at home, you just hang out for a while. And then we'll do some muscle energy techniques. So we're gonna go ahead and pause it here or pretend that we did it. So if you're doing this with me, go ahead and pause and come back on in about 5 minutes or so. So we're gonna pretend that that's over with, okay? So then you're gonna go ahead and remove these wedges. And actually, just real quick, I think I'll show people with the ball. Go ahead and lift up. We're gonna put this under your sit bone and put this underneath. It does feel different, doesn't it? But can you tell how it's pushing? You like it? Yeah, I actually really like this too. So when I've had the same rotation, this would actually be very relieving for me.
I like it better.
Yeah, so it's rotating this forward and rotating this back, and then you just hang out there for a while. So, okay, now go ahead and take those off. Now we're gonna use the muscles to help also move the bones of the pelvis back into place. So I like to explain this so that it's easier then to remember. So your hamstrings attach on this sit bone here, and the hamstrings on the back of the thigh here, if we make them contract, they're gonna pull on that, which is gonna make that ilium rotate back, which is the opposite of where it's rotated now, correct? So what we wanna do is make these muscles work. Well, at the same time, the muscles that are on the front of the thigh on the left, they're attached in the front of that ilium, this area. If we make these contract, it's gonna pull this ilium forward. So this one's gonna get moving back and this one's gonna move forward because of the help of the muscles, okay? So what we're gonna do is have her take the bottom of her foot on the right side, put it on the thigh above the left knee, never on the knee, okay? And I'm gonna ask her to press into her thigh, and what that does is create, I felt that muscle kick in right there, and then now I'm gonna ask her to push the left thigh up into the foot. Now as she does this, there might be a little bit of knee bending here, that's fine, but you'll see this doesn't come up real high off the floor. Now she's gonna hold that for 10 whole seconds, so I tell people, or 6 whole seconds, you either count to 10 quickly or you count to 6 very slow. So go ahead and relax, she's been doing it that whole time. And we're gonna do that 3, maybe 4 times, we'll just do it 3 times. Go ahead and push again, hold, 2, 3, 4, 5, 6, and relax. And let's do it one more time. 4, 5, 6, and relax. Okay, that's all. You do not do the other side. Okay, now after that, we're gonna do an adductor squeeze. A couple of ways of doing that is, I actually need a yoga block, so we'll get that in a moment. But you wanna squeeze the knees together. And what happens is, this pubic symphysis right here in front where these 2 bones come together, when it's rotated, it's actually uneven. So the right side in her situation would be lower and the left side would be higher. Now that we've done this correction, there's some instability here. So the adductor muscles, which come along, the inside of the thighs here, if we contract them together, it helps to kind of reset this pubic symphysis so that it stays better. Sometimes there can be a pop when you do this, not very often, but don't let that freak you out if that happens. So you want to use something that's firm. If it's a smaller person, you're going to use, if you have a yoga block, I use the inside like this. You can also use it this way. So we're going to put this between your knees and go ahead, squeeze hard and hold that for that 6 seconds. 1, 2, 3, 4, 5, 6, and relax. And let's have you do that again, twice more. Go ahead and do that on your own. So sometimes if you really are having a problem with this and you don't have time to sit with the ball or the wedges under there, sometimes even this muscle energy technique, as we call it, will help relieve your symptoms. It's not changing the fascia and things that is what we really want to do, so it's not going to hold maybe as long, but it can be helpful and relieving. So especially I use this a lot with pregnant women who are, their ligaments are very lax, so they're moving a lot. It will really help them. So how did that feel, Ann, to do this? Okay?
Oh, good.
Okay, so do a little bridge. Just lift your bottom up and then lower down so we notice that she's nice and straight. And let's bring the legs out, see what that did. And voila, it is even, okay? So let's see if it's even when you do the long sit. So you'll be able to tell. Do you see a difference?
Mm-hmm.
Yeah,
right.
it's even.
Each other.
Yep. So if she does this every day, and it's not going to hurt her to do it every day if she's continually rotated like that, it's going to start changing that connective tissue that's rotating her backwards and will help eventually relieve the discomfort or pain that's in her left side and create a more balanced pelvis. Yay. Yay. Thanks, Dan. Go ahead and stand up. Let me see if it looks better in standing also. It does. So in standing, the landmark here was forwards because the pelvis was like this. Mm-hmm. And go ahead and turn around. this is even also. All right, way to go. So that's right anterior rotated pelvis. Thanks, Ann.
All right, thank you.
So Amanda has a left anteriorly rotated pelvis instead of a right one. So we're going to look at those landmarks and confirm that. And sure enough, the right side is back compared to the left side, which is forward. So go ahead and turn around. Let me take a peek here. And when I look at the bony landmarks back here, the ones on the left are higher. So it's showing this rotation this way compared to the right side, which is going back this way. So obviously that's hard to see on yourself and you really can't compare it well. I don't even do a good job of checking it on myself, especially in standing. So let's have you lie down, Amanda, and we're going to look at the leg length and confirm that when that happens, when the left side is anteriorly rotated, the left leg is functionally longer typically, if that's all that's going on. Now, sometimes there are other things happening, but in general, yep, sure enough, I can see that her left leg is longer here. So we're gonna do the long sit. Let me give you your hand, and when you come up, don't move your pelvis once you get here, so that's good. And then, can you see a difference in your legs here? Mm-hmm. You can see it. Yeah. So even if I move my hands, you have stripes on your socks, that's actually pretty good. So can you see yourself without me? You can almost feel it, can't you? Okay?
Yeah, I can see
so that way she knows, yes, I still have my left anterior rotation, so now she's ready to self-treat, okay? So now we're gonna do the opposite of what we did for the right anterior rotation. And with the pelvis going backward on the right side, forward on the left, we're going to change the position of the wedges or the balls. So what happens here is under the left sit bone is where we're going to place the wedge. And we do this on an angle up underneath the sit bone. So let's have you bend this knee a little bit. And we're gonna come up under here. Just gonna feel where that is and go ahead and does that feel like it's on the sit bone for you? Mm-hmm. Okay. And sometimes it takes a couple of placements to make sure you've got it right. And then let's come up this way. So I feel for the edge of her pelvis, and I make sure that the wedge is not in her low back, okay? It's really under the pelvis, and it's straight horizontal into there. So how does that feel?
Feels fine, feels good.
It feels weird usually too, because it's off, it feels lower on one side, higher on the other, and it's supposed to feel that way because we're trying to change that imbalance. So right now, with the way that she's wedged, we're taking up the slack of that connective tissue and giving it time to settle in and to wait. So you can also do this with the balls, where we would put them in the same position underneath the iliac crest. Well, it's going to be up the other side here for the rotation, or under the sit bone on the left, because she's rotated forward on the left, okay? So we're going to hang out here for a while, and preferably at least 5 minutes. I mean, sometimes I've had people on the wedges for maybe even 15 while I'm doing other things with them if they're in for a treatment. So we wait for a while. So while Amanda's here waiting, she can also take her hands to her pelvis and help this process out a little bit. So what you're gonna do is just keep your hands soft and put your hand on your pelvis, or like kind of on the below of where we put our hands on our hip, just kind of on the side. And your whole hand is soft. Let's do it over here too. So now remember, the way it has been is the right has been going backwards and the left has been going forward. So she's going to just guide the other direction. So she's pressing in a little bit, and the right side is kind of rolling toward her foot, and this side is rolling towards her ribs. And she can just hold here for a little bit. And then we've been here for a while now, so we're going to go ahead and have her remove the wedges. Go ahead and lift. And let's also show what it would look like with the balls under here. So we want, for the left side is going forward, so we would put the left one under the left sit bone and the right one under the upper part of the pelvis. So let's place the right one first. I'm feeling for where her pelvis is, right there. And then on this side, it's gonna go just at the bottom of your glute, actually bottom of your buttocks, where you have your sit bone, and so it should feel uneven, right? Okay, so it's up here and down here, and you never do it the other way because we're trying to get that specific result. So we've done this enough with the wedges. Let's go ahead and take them out. There we go. And now we're going to do muscle energy technique to bring the pelvis even further into alignment. So what we want to do when the pelvis is rotated on the side it's going forward, the hamstrings are attached here to the sit bone. So what we want to do is contract the hamstring so it tugs on this sit bone and effectively rotates the pelvis back. The muscles that are here in the front on the right side, we want to rotate that pelvis forward, and so we contract those. And this is what it looks like. So again, we want to contract the hamstrings on the left. So we're going to take the foot, the left foot, put it on top of the right thigh, above the knee, not on the kneecap. And as you push your foot into your right thigh, Amanda, go ahead and do that. I can feel your hamstring kick in. So what that's doing is pulling on the sit bone back here. Now I'm going to have you lift this thigh up into the foot too. Now there's not a whole lot of movement here, and you can even bend the knee a little bit, but because we just want the thigh, but she's going to hold it here for 6 full seconds. She's already been holding it for a little bit, so go ahead and relax. We're going to do that 3 times, and go ahead and do it again.
Do you lift the whole leg or
No,
just the top?
you can actually just even bend the knee a little bit. Yeah, like that. Yep. So push them together. It's like you're smashing them together. 2, 3, 4, 5, 6. Relax. And then one more time. And it's just a nice steady pressure. Doesn't have to be, 100% effort, but you want it just steady and solid. And relax. And so now what we're going to do is that adductor squeeze, where we're setting this pubic symphysis by using the adductors. So it's really great to use a yoga block. You don't want to use something that's too squishy because it's not going to give you that firmness. If I was doing it with a patient, I use my arms or put my forearm in there. Go ahead and bend your knees, Amanda. We're going to use the yoga block. And we can either do it wide like this or narrow. So I think the narrow would be good. Go ahead and squeeze and hold. And again, that solid 6 full seconds, waiting with that adductor squeeze. And then relax. And we're going to do twice more. Hold it. And relax. And last one. And relax. And so let me show just one more thing that I've used a lot of times. I always have these balls in my headboard, so I will use them at different times as I'm falling asleep or getting up in the morning. And I would use these for pelvic correction, placing them behind like I showed you, but I wouldn't always have a yoga block. So what I would do is hold them both together like this. And Amanda, if you could grab these here.
Yep.
And so because her legs are too far, she can go ahead and lift both legs up. So go ahead and lift them up and squeeze. You're kind of holding them and squeeze. See how it gives you a little bit of pressure?
Yep.
It's better than nothing. So
Yeah.
you can use it there and then relax. And that way you're just using the balls. So I will often travel with these two, but I'm not always traveling with a yoga block, right? So
True.
hey, do a little bridge. So we'll see what the alignment is. Go ahead and lower back down. And let's straighten the legs out. And like magic, you look better.
Good. Awesome.
I would like to do a little bit more treatment here, but she's really, really close. Let's see what happens when she goes to long sitting. Go ahead and come up and don't move your pelvis when you get here. Do you see the difference?
Yeah, I do.
Oh yeah, it actually looks better. Looks better here even. So perfect.
Yeah.
So
Great.
doing that every day, like you could even just check this right away. And because you have been off a number of times and that we're aware of, I would say just do this every day. It's not going to hurt you. It's only going to help. And so at some point, we want to keep tabs on it to make sure that you aren't going the other way. And some people are hypermobile, but when you know you're not, definitely do this. So
Awesome. Thank you.
Thanks so much for watching. Essential Therapies is located in Toledo, Ohio, where we focus on the John F. Barnes myofascial release approach.
If this video was helpful, please hit that like button and subscribe to get future videos. Thank you.